Hi, good evening. This is Swati, Assistant Professor from SNS College of Pharmacy and Health Sciences. Now we are going to see indirect and mixed acting sympathomimetic agents. First of all, we should see what is meant by sympathomimetic agents. These are a substance that is going to mimic or modify the actions of endogenous catecholamines of the sympathetic nervous system. Here, direct agonist means it is directly going to activate adrenergic receptors, while indirect agonist will enhance the action of endogenous catecholamines. Let's move to the classification of sympathomimetic agents. Sympathomimetic agents are classified into three types. One is direct acting agonist, indirect acting sympathomimetic agents, mixed acting sympathomimetic agents. Now we are going to see indirect acting and mixed acting sympathomimetic agents. Indirect acting examples are hydroxyamphetamine, pseudoephedrine, propylhexedrine. Mixed acting agonist examples are ephedrine and metforminol. So here I have missed the point, that is sympathomimetic agent is going to stimulate alpha adrenergic receptors, beta adrenergic receptors and dopamine receptors in various target tissues, that is the heart, eyes and vascular smooth muscles. The agent which is going to act on the adrenergic receptor directly or indirectly blocking the breakdown or neuronal uptake of catecholamine. That is, sympathomimetic drugs is going to increase heart rate and blood pressure. Already we have seen the classification of sympathomimetic agents. Now we are going to see briefly about the indirect acting sympathomimetic agents. Indirect acting sympathomimetic drugs are those that is going to act indirectly to increase the concentration of endogenous neurotransmitter by release of endogenous norepinephrine. These drugs will going to enter into the nerve ending by active uptake and displace of norepinephrine from its storage granules. First one is hydroxyamphetamine. Hydroxyamphetamine is indirect acting sympathomimetic agent and derivative of the amphetamine. Its chemical IUPAC name is 4,2-aminopropylphenol. See the structure here. In the phenol structure, we have substituted 2-aminopropyl, that is 2-aminopropyl structure. It is a white powder and it is freely soluble in water. Its mechanism of action: indirect acting sympathomimetic agents which causes the release of norepinephrine from adrenergic nerve terminals. Uses of it is an asymptomatic and anticholinergic combination and relaxes muscles of eye by dilating the pupil, which is mydriatic. In narcolepsy, that is sudden attack of sleep in completely inappropriate situations, it is used in children with hyperkinetic syndrome. It is also acting as an anorexian. Anorexian means a drug that is act on the brain to suppress appetite in the treatment of obesity. Next, we are going to see pseudoephedrine. It is an optically active isomer of ephedrine. See the structure. Its mechanism of action: it stimulates both alpha and beta receptors. It is also stimulating the central nervous system. Ephedrine is used as a vasoconstrictor to treat nasal and sinus congestion of tubes that drain fluid from your inner ears. It increases the blood pressure by increasing cardiac output and by causing vasoconstrictor. Next structure is propylhexedrine. Its chemical, that is IUPAC name is 1-cyclohexyl N-methylpropan 2-amine, that is 2-propanamine. We can also say it as 2-propanamine. Its mechanism of action: it stimulates alpha receptor in the mucosa of respiratory tract, and same action shown as epinephrine and norepinephrine, used for the relief of congestion due to cold, allergies and allergic rhinitis, inflammation of mucous membrane of nose, and its euphoric effects. Next, we are moving to the mixed acting drug. Mixed acting sympathomimetic drugs means they are those causes activation of adrenergic receptor by both direct binding as well as endogenously stored norepinephrine from the presynaptic nerve terminals. See the ephedrine structure. It is chemically 4,2-aminopropylphenol. It occurs naturally and and it has two asymmetric carbon atoms, so it will be having 4 isomers. It is going to act both directly and indirectly. It stimulates both alpha and beta receptor. It is used as bronchodilator, nasal decongestant, orthostatic hypotension. It means the condition in which your blood quickly drops when you stand up from a sitting or lying patient, or myasthenia gravis, that is a neuromuscular disorder that causes weakness in the skeletal muscles. It is used in various allergic diseases like hay fever, that is an allergic reaction to pollen, and urticaria, a skin rash triggered by a reaction to food, medicine, or other irritants. Next structure is metforminol. Its IUPAC name is 3,2-amino 1-hydroxy propyl phenol. It is a white crystalline powder and freely soluble in water. It acts on both alpha and beta receptor, stimulates noradrenaline. It can be used parentally as a vasopressor in prevention of acute hypertension state occurring with spinal anesthesia. Thank you.